Welcome everybody to today's webinar. We're really excited to have a very special guest with us today. Russell Horning from Buoyant Health is joining us. He's an innovative mental health provider and wellness clinic in Phoenix, Arizona. Before we get started, I just wanted to start with some introductions. I'm Diana Gaybauer, and I'm our Client Services Manager at iHealthSpot, which is our marketing and website division dedicated to NP Advantage and Medical Advantage. Russell, can you tell us a little bit about yourself?
Absolutely. So my name is Russell Horning. I'm a psychiatric nurse practitioner. This is my 20th year in practice here in the Phoenix, Arizona area. I've worked in a variety of different settings, and most recently very excited to talk today about my own practice, this My Buoyant Health adventure. I don't know what else to say about myself. I mean, we could talk about sort of like casual things, like I like to run, and got a grandson and daughter who I'm actually working with in the office. Right. That is really exciting. So you may hear the baby in the background because it is a baby-friendly, family-friendly office that we have here.
That's all of us who work from home these days. So totally Absolutely. Get it and embrace it. So that's great, Russell. So we'll dive right in. I understand you've made a major career change lately in opening your own practice. Can you tell us a little bit about what motivated you to go into an independent practice and some of the goals you had for your practice?
Absolutely. So when I was thinking about our conversation today, I could go on quite a while complaining about sort of the greed in healthcare and how venture capital is sort of ruining it, turning healthcare into a business. And really, I think my sort of vision of healthcare has always been wellness. And so not really focusing on just prescribing or treating people's illnesses, but really trying to help people prevent illness and feel better and more functional. And so my sort of change in path recently was nudged very strongly by that. This idea that, I'm seeing too many patients, I'm getting bogged down, can't really do things the way that I think they should be done. And I've always been sort of afraid to take this leap into private practice. But it has been, beyond my expectations with this process.
Great. Yeah, I can understand it. The idea of opening your own business seems like a really big risk in a lot of ways. But excited to hear that we have providers like you joining our healthcare system, Russell, with the quality of care it sounds like you dedicate to your patients. So it's really exciting to have you. Can you tell us a little bit about what led you to your decision to work with NP Advantage?
Yeah. So I've always been an employee, like as a nurse working in a hospital and then provider groups. I've always been very comfortable being an employee, collecting hourly wage, getting a percentage of salary, and working with NP Advantage. Like my hesitation or fear was always like, I don't want to deal with insurance. I don't want to have to do the administrative stuff. I just want to treat patients. And so NP Advantage provided this sort of collection of services that really supports me and has allowed me to pursue this now. Like they handled credentialing, really sort of interpreted or for me, this different language almost, having to follow up with the paperwork and deal with all the different plans. And it's really taken that load off of me. So I can really focus on the development of the practice and treating people. And NP Advantage has been extremely responsive from the first conversation, as far as, they're getting back to me when they say they're going to get back to me. They're, meeting milestones along the way. So I've been very pleased with that.
That's great to hear, Russell. As an organization, we've lived in the space between health plans and providers for a really long time, and it's exciting, to talk to folks like you and hear all of the good work that reducing some of that administrative burden provides to you, and being able to see patients and do what you got into business and practice to do. So that's really exciting to hear. I know that credentialing piece is incredibly tedious. And I know, you've been pleased with your website as well and some of the marketing services by NP Advantage. If you have any, feedback on how that process went as well for you.
Yeah, absolutely. So, I mean, the support from that area, like I know very little as far as like how to set up a website. I know sort of what I like, but having to track down, and hire different contract people seems like sort of a nightmare to me.
Hmm.
And so being able to have it all in one place, but then also like the product, the website that came out with all the information and the resources and everything really smoothly flows and it's very patient friendly. Um, when I send, comments, suggestions, like they get back to me right away, and I'm extremely pleased. And not just the website, but also like the social media management and
Right.
the Google optimization, all of that sort of taken care of. And again, a foreign language for me. I didn't even know what optimization of the search engine was before starting this. So now I know a lot more.
Right. I love that. And another important branch of the services NP Advantage provides is the EHR optimization and implementation. How is that branch of the NP Advantage wheel for you?
So over the years, I've used a number of different EMRs. So I have been in that position where I've helped to, build out and roll out the systems to groups.
Hmm.
But having somebody work with me to make it just the way that I want has been fantastic. The
Great.
ECW, or Clinical Works program, that we're using is very user friendly. I'm happy that it has sort of the video built in. It's got all the sort of resources that I would want out of an EMR.
Hmm.
And then the support team that we have that isn't just like the worldwide support team, but actually that sort of NP Advantage specific ECW support team. Like they get back to me the same day most of the time, and they're addressing my issues, updating things. It's been fantastic.
Great. Very happy to hear that. Were there any surprises in working with NP Advantage for you? Initial reactions, overall impressions, anything we didn't cover in those last couple of points for us?
Yeah, I mean, for me, there was a lot of learning. Like I've been in healthcare for 20 years, so I felt like I knew quite a bit. But really helpful to just having the person, Brandy was amazing. She's still been my sort of liaison along with this, and she provides me with updates, and I can reach out to her with questions. But then each team along the way has worked really well together. So having the EHR team and the marketing team, everyone just sort of step by step communicating. I haven't really had any surprises. I think it's normal that I would have liked it to happen sooner, but that wasn't in
Yeah.
the advantage. That's just sort of insurance and the healthcare
Yeah.
system in general.
Yeah, of course. We understand that world all too well. Um, so tell me how my Buoyant Health is doing today for you, and what the future looks like for your practice now that everything is live for you.
Absolutely. So we opened in the beginning of December. I've been working a couple different jobs just to make sure that I can pay my bills.
Yep.
So started with 2 days a week, and within 2 weeks, I have a full schedule for my 2 days a week, and I'm actually scheduling out almost 2 weeks. So I've decided to increase a day a week, so I'll be here 3 days a week. I was able to justify hiring an office manager, which has been fantastic. She's helping a lot with sort of the front end insurance and then the back end, like prior authorizations. My
Right.
daughter, as I think we mentioned,
Yeah.
is here in the office with me. So family friendly office, but she's doing a lot of intakes and she's a certified health coach. So she's been able to sort of start seeing some people and helping people. Um, it's just very exciting. I've even talked to the landlord already about, what if I need a little bit more space because it's going so well and I want to expand and, bring on a therapist or another
Right.
provider and add some room. So like it's happening as fast as I could have imagined.
That's really exciting to hear. I understand in the grand scheme of healthcare too, there's providers who are leaving the profession faster than we're getting providers in. So to have folks like you who are starting your own independent business and then finding success in that, so patients have a home and have a trusted advisor in their care is really exciting to hear in so many ways for you and the patients who find their way to you.
I agree. I probably would have, if I hadn't had NP Advantage and tried to do this myself, opened up months and months earlier before I really had all the insurance plans in line and really that sort of marketing piece. And I can picture sort of trickling in and really being frustrated with how things are. And I did complain a little bit along the way about why isn't this happening faster? But I really do appreciate now the fact that everything was in place and now I'm open and I can just hit the ground running. So like I really appreciate that.
That's exciting and great to hear. I feel like it's exciting a lot because it is. And when you mention frustrations, that's something we understand in so many ways because ultimately it's your practice and your livelihood, and your goal is to see and treat patients. And whenever there's a delay in that, it impacts so many things. So we're happy to be in a space where we can help try and move that needle, and move things in the right direction for providers like you. So we get that piece. So before we wrap up, Russell, do you have anything else you'd like to share with our audience today on any topic that we may not have covered?
Absolutely. I mean, when it comes to mental health in general, I think that, really this idea that mental health can't be separated from physical health. And so, yes, I work in the mental health space, but really working towards getting rid of that separation and that stigma of, we're talking about depression when really we're just talking about wellness. And so, working all together, I imagine that a lot of people who are watching this, podcast webinar are mental health or medical professionals. And so, as much as we can work together to treat the whole patient, I think really that is sort of my message going out there.
Great. Well, if anyone watching is a provider in the Phoenix, Arizona area, we hope they'll refer patients to Russell. It's a fantastic practice. And for any patients that may have found their way here, likewise in Arizona, my Buoyant Health is a practice we love and appreciate. So any last minute advice, Russell, for any nurse practitioners seeking independent practice finally?
Yeah, so Arizona has always been a wonderful place to work as a nurse practitioner. Across the country, of course, different states have different rules as far as what you're allowed to do. And in Arizona, being a full practice state, like it's always been very good to me. And so getting a little bit of experience, having a network of people that you can reach out to, building that sort of professional, personal network of, if you have a difficult patient or someone who's not in your specialty, to refer to, I think is very important. And then as a nurse practitioner, I really think that we need to understand our worth in the healthcare system. And so, being independent, starting your own place is a little bit scary and shouldn't be taken lightly, but I don't think it has to be as scary as I thought it was originally. And having companies like NP Advantage to sort of assist with that sort of administrative part, guide a little bit with the marketing, it really takes the business part out so that we can focus on the healthcare part and be successful.
Great. Well, thank you so much, Russell. With that, we'll conclude the discussion today. Thank you to our audience for joining us. We sincerely hope you found the content helpful, meaningful, inspiring to your independent practice journey. Thank you again, Russell, for joining us and sharing your knowledge and insights, both in your venture to become an independent practice and in the mental health field. If you'd like to learn any more about Russell's practice, please visit mybuoyanthealth.com. And if you're interested in learning more about NP Advantage, visit our website for a lot of free resources, blogs, guidance. and reach out if you'd like to have a conversation about NP Advantage and how we can support your independent journey. Thank you.